Hello, my name is Dr. Sara Wasserbauer, and I'm here to talk to you today about the criteria for American Board of Hair Restoration certification and the application process. Applying for ABHRS certification is a rewarding challenge. The American Board of Hair Restoration Surgery is the only recognized certification for hair restoration surgery worldwide. Out of roughly 1,200 members of the International Society of Hair Restoration Surgery, only about 200 people have completed the rigorous pathway to achieve the designation Diplomate of the American Board of Hair Restoration Surgery. Diplomates of the ABHRS enjoy many benefits. Most of the general public is not aware that any individual with a medical license can legally perform hair restoration surgery. As a result, the surgical and aesthetic skill level of a physician offering hair restoration surgery can vary significantly. Also, although genetic hair loss is common and usually easy to diagnose, it's important that as a physician you understand the other causes of hair loss and that you're properly trained to diagnose and treat these other causes. You can take and pass the test if you perform hair transplant surgery and know what you're doing. Do you perform all FUE? You should still be able to pass this test, as long as you at least understand what linear excision is all about. Are you exclusively performing linear excision? No problem. As long as you have a working knowledge of the advantages and disadvantages of FUE, you should be able to pass this test. Becoming a diplomate of the ABHRS takes a little advanced preparation and can easily be accomplished in the course of a normal hair transplant surgeon's practice. Most candidates start thinking about sitting for the exam 1 to 3 years before taking it. Even if you are just beginning to perform hair transplant surgery, you can achieve the standards set by the ABHRS, since most of the items you already need to even be in practice. Think of the process as a series of little checkboxes. For instance, all applicants need to submit a photocopy of your current, valid MD or DO license, a self-declaration that all the licenses in all jurisdictions are clear and unrestricted, and this is basically a letter attesting to that fact. You're going to need evidence of current and valid basic life support training, and you're going to need a current copy of your curriculum vitae or your resume. One of the last things you'll need is 2 reference letters from physicians who have a personal knowledge regarding your level of knowledge, your skills, your training, your experience. These references should offer their personal recommendation on you as a candidate to sit for the ABHRS exams. Now, if you're from the United States, there's one additional step you have to take. You have to do a self-query or a physician profile from the American Medical Association, the American Osteopathic Association, or the Federation Credentials Verification Service. If you're from outside the United States, this does not apply. So this is all easy, right? Strangely enough, most applicants find that the 2 letters of reference are the hardest to achieve. My best suggestion here is to simply get to know your teachers. For instance, are you sitting in an advanced board review course right now? Get to know your lecturers. Was there a professor who first introduced you to the delights of hair restoration surgery? Give them a call. How about a colleague that demonstrated that new technique? ISHRS live surgery workshops are a great place to start making these connections. Let them know what your plan is and ask for their endorsement. It is completely acceptable for letters of reference to come from the ISHRS and/or are acceptable from current members of the ABHRS Board of Directors or even from the examination committee itself. There's 3 routes for your candidacy, and you will likely fit into more than one, so just pick the easiest route for who you are and how you practice. Number 1 is the experience route. Number 2 is the fellowship route. Number 3 is the lifetime achievement route. And number 4, well, I only mentioned 3, but there's an added one that I threw in there called the Certificate of Added Qualification. More on that later. For the experience route, an applicant must be able to demonstrate 3 years in private practice of hair restoration surgery, either by yourself or with a partner. Case logs of about 150 surgeries over 3 years. Now let me demonstrate what one of these would be like. Each one of these would have the procedure type, whether it's FUE or linear or a hybrid or however it is that you practice, the date of the surgery, the graft count of each one of these surgeries, patient age, and gender. You will also need to turn in 50 operative reports. And these are, again, just the facts. I'll give you an example. So here's an example from the 11th of August. The offices, my office is here in Walnut Creek, California. You would list the surgeons, the assistants, the patient's history, what was done, and the post-operative. 6-month and 12-month follow-up visits should also be included. Of these 50 reports, pick 5 to also submit 10 total before and after patient photographs. For this, you want a representative sample of the work that you do. For instance, if you do both linear excision and FUE, submit before and after photos of your patients who have done one or the other. In other words, the committee wants to see all that you've done and understand that you really are competent to take the exam. They don't want to waste your time. Show off how good you are. If you did a particularly successful reconstructive surgery or a female hairline that looked awesome, let these photos speak for your expertise. One more point. If you are from the United States, you have to turn in proof of at least 60 hours of continuing medical education credits, known as CME. But that's, again, only if you come from the United States. There is another route, and this one is called the fellowship route. This is probably the easiest of the routes for taking the ABHRS exam, but for the hardest from the standpoint that you actually have to do a fellowship in order to complete the requirements, especially if you already have a job in another field of medicine. Here are the requirements. The applicant must have completed a 1-year ABHRS approved fellowship in hair restoration surgery, which is the equivalent of about 70 cases. The applicant must document proof of 1 year experience in private practice in hair restoration surgery. Case logs of at least 50 surgeries over at least 1 year, 50 operative reports, just like in the last experience route, 5 of these op reports to also submit 10 total before and after patient photos. So it's really very similar to how the previous one was done. Fellowship route and experience route are very similar. The third route is the lifetime achievement route. This is the hard one for most beginners to conceive of completing, but it's the easiest for those who've been doing this for a while and finally want to earn their stripes or prove that they've earned them. Here is what you will need if you want to follow this route. Case logs of 400 surgeries over a period of 8 years, 50 operative reports, and then once again you have to pick 5 of those operative reports to also submit 10 total before and after patient photos. So what if you're new to hair? Let's say you really want to prove yourself to your patients and start taking advantage of all the ABHRS has to offer, but you have not yet done a fellowship or gotten all those surgeries under your belt. This is where the Certificate of Added Qualification, also known as the CAQ, comes into play. The CAQ is a nifty little category of ABHRS certification that allows you to take the written exam first, and then to take the oral exam later if you desire. All you have to do is submit proof of attendance at least 2 ISHRS annual meetings, submit proof of attendance for 16 hours of an ISHRS endorsed live surgery workshop. One workshop should give you most, if not all of this. And then submit case logs of 25 surgeries. Then you can take the written exam, and once you pass, you get the Certificate of Added Qualification. So you see, the whole process is a little like getting your medical license in the first place. It's a series of little check boxes designed to prove that you do indeed have the level of experience and dedication to be considered among the best in your profession. One note about submitting photos. Take good photos from the very beginning of your practice. This will help you immensely. As Dr. Bob Haber says in his seminal online training for photo taking and hair surgery, if you haven't photographed it, you have not done it. In years past, applicants sent in photos that did not allow the credentialing committee to evaluate the most basic details of the surgery they were documenting. For instance, don't send in blurry photos. And if you're doing a cosmetic surgery on someone's hairline, don't cut off the top of the head when you are taking a picture. Some guidelines for acceptable photos are: label the before and after parts of your photos. Use the same 5 or more standardized views each time. Photos must be 4 by 6 inches or larger and in electronic format, either a PDF or JPEG. No paper photos anymore, please. Photos must be clearly marked as to how many sessions have been performed and the time since the last session. So if you do 2 FUE sessions, 3 months apart, label that. Your after photos should be at least 9 months past when the last surgery was done, or later, not before. This is just common sense. The hair will not be sufficiently grown in yet to show your work. Remember, you're trying to demonstrate your excellence here. For a great primer on how to do this, it is now your homework to watch the following entertaining and informative essential videos on the ishrs.org website. The first one is Mastering Clinical Photography in Hair Restoration Surgery, and the next one is 10 Tips for Taking Great Before and After Photos. The ABHRS exam is a rewarding challenge that stands as the only psychometrically and statistically validated examination dedicated to the specialty of hair restoration surgery. If you are proud of your expertise, interested in upholding the highest standards in hair restoration, and committed to being in this field for the long term, the ABHRS is the logical path to which every hair restoration surgeon aspires. Good luck on the test.